Hello, everybody. Welcome to the fourth and final live session to catch up from today's all of today's good topics, but also the summit as a whole. I hope you've really enjoyed the kind of diverse range of topics across the summit as a whole, but today, which brought together a lot of different aspects that maybe we hadn't considered about treating allergies, about optimizing our allergic dogs management plan, and really, I guess, highlighting the fact that there's an awful lot going on and an awful lot to think about. So I know there's a load of questions lined up, but kind of briefly to run through the topics, the conversations that I've had on today, day 4 of the Allergy Summit, just in case you haven't managed to get to all of those. Starting off on the list, it was inviting Dr. Charisse Roth back. You saw her, you met her on day 3, where she was talking all about non-antibiotic treatment of skin infections, but she was talking about veterinary mental health. Now, clearly it's not related to allergies at all, but I make no apologies for that. It's an incredibly important topic. We've got veterinarians, we've got technicians, nurses, reception staff leaving the industry in droves because they are burnt out. There's various different reasons for that, as Dr. Charisse discusses. And to make matters worse, male technicians are 7 times more likely to commit suicide than the general population. Nurses, veterinarians are not much better. So it's a huge problem, and it's one that I'm clearly passionate about, and I'm keen that more people learn about. It also has an impact on you, the pet parent, when it comes to seeking veterinary care for your pet. So not related to allergies, but I definitely encourage you to check that out. And, thank you in advance for all your support for your veterinarian and your veterinary staff. I spoke to Dr. Christopher Byers about allergy emergencies. So this is not so much a long-term allergy problem, although those that do suffer from allergic reactions to bites and stings, which is what we primarily talk about, can get repeat episodes. But we talk about, when do we need to actually worry if your dog does get stung by a bee. That's the most common thing that I see, especially at the start of spring when the weather's warming up and all of these insects are a little bit drowsy. Depending on where you are in the world, there may be very different insects available, but Dr. Byers gives some fantastic information about dealing with allergy emergencies, when you need to worry, when you need to get to the vet, and the treatment that can be given for that. So that was a fantastic conversation. It was actually the first conversation that I had it's probably about 6 months ago when we started all of these conversations. So it was fantastic to speak to Dr. Byers. I spoke about monitoring and optimizing your allergy treatment plan. So discussing some of the actual ways that that can help you implement a plan that actually works. And that's very important. Clearly, it's very easy to follow advice, to implement treatments and maybe think that it's working, but actually our mind can trick us. And I talk a little bit about that. I also talk about following kind of the path of evidence, and what an evidence-based approach is all about, which is one that I absolutely believe in as well. I spoke to Dr. Dan. Dr. Dan is a fellow veterinary YouTuber and a veterinarian in practice as well. And he spoke about skin autoimmune diseases that act like allergies. So we actually had a question, I can't remember if it was yesterday or the day before, about kind of losing hair and some lesions on the bridge of the nose. And I discussed there that we could be dealing with something different, something like pemphigus or lupus, which are autoimmune conditions. So Dr. Dan talks all about that. And it also goes back to day 1, where a lot of my guests spoke about the importance of actually reaching a good diagnosis. And we discussed that in a lot more detail. We discussed about what tests are appropriate to run, what tests are maybe completely useless, and all of that kind of good thing. Some of the other conditions that we need to be thinking about, rather than just jumping to the diagnosis of allergies in a dog who is itchy and has got some skin lesions. And then finally, we spoke to Dr. Edward Bassingthwaite, who is a veterinarian in Australia, all about the role of anxiety in allergic conditions. It was a fantastic conversation. We spoke a lot about how anxiety and an existing anxiety can feed into allergies, and maybe making things worse that way, but also how allergies can result in anxiety, and how we need to consider whether we need to address that and how we can go about addressing that. So Dr. Edwards is all about anxiety. So there's actually a dog anxiety summit coming up, which I believe is the next summit which he has put together, which I'll be speaking in as well. And if you're interested in that, you can go to the link's not live yet, but it will be in a few weeks. It'll be ourpetshealth.com/allergy summit. Will be a link for that. You can also you'll also get emails about that, I'm sure, from the team at Pet Summit. So that's kind of a run through of day 4's content. So I hope you've enjoyed the sessions that you have managed to watch already. If you haven't watched all of them, then yeah, I'd encourage you to go and check them all out. As with every single day, all of my guests bring a huge range of expertise, knowledge, and passion to our conversations, and we were very lucky to be able to share that with them. So, as with all the sessions so far, if you've got questions, if you leave them in the comments on either Facebook or YouTube, wherever you're watching this, and they will be flashed up on my screen by the team. So, with that in mind, we can crack into that first question. So my dog is on Temerol P every other day. She had an allergic reaction to Cytopoint, and I'll not use Apoquel. She's never been skin tested because she had a reaction to anesthesia, so I really don't want to go under sedation. Would blood work be worth doing? Teresa, so good question, Teresa. So Temerol P, I believe, is a steroid and an antihistamine combination. So we spoke before about kind of steroids and how it's something that we used to rely on a lot because we have these other options. We don't tend to use them so much because of the side effects. So I'd be interested to know why you won't use Apoquel. I know there's a lot of scaremongering out there about cancers and things like that, which to be honest, I don't believe the evidence shows that there is a increased significant risk of cancer development. I think there's a bit of 2 + 2 = 5 with regards to the label claim of not using Apoquel in dogs with cancer, and that doesn't necessarily follow that it then therefore causes cancer. So I believe that Apoquel is a very useful drug in our arsenal, and does a fantastic job. With that in mind, as with kind of everything that we've spoken about in all of our other days when we haven't been discussing drug use, if we can do all of these other things that have been discussed, then hopefully we don't need to use any of these drugs, or we can reduce our reliance and our need for giving steroids every second day. With that in mind, and I guess you'll have to excuse me, I do go off in tangents, as I said yesterday. So when I get a thought, I do just like to talk. I think we need to, with that in mind, if Teresa, you know, we're doing all these other things, and I'll come back to that blood test question in a little bit. If we're doing all those other things and you're still finding your dog is itchy, but being on that every other day steroid works, or if it's on the Apoquel at the time of year when your dog is itchy, or the Cytopoint injections, if that's needed to keep your dog itch free, completely itch free and comfortable and living their best life and living their best quality of life, then that is something that I absolutely believe should be continued, because I believe we need to focus on quality of life, and we need to realize the impact, even just a mild background itch that is persistent, the detrimental effect on a dog's life can be huge. If any of you have ever suffered from any kind of low-level skin condition that causes itchiness, you'll know, and I know, it can keep you awake at night. It disturbs your sleep. It makes you grumpy. It makes you grouchy. If you've got any low-level pain, it's exactly the same thing. It just brings you down. It makes you grumpy. And so I think the burden is on us to use all of the tools, all of the proven tools in our arsenal to focus on this quality of life. And that's something that I am very, very passionate about, and something that I believe very strongly. But Teresa, never been skin tested because she had a reaction to anesthesia, so I don't want to go under sedation. So that's that's completely understandable. I guess one thing that I do come across is when I hear about potential reactions in previous patients of mine, and I go back into the notes, it was a a possible question mark. There were maybe other things involved, maybe drug regimes involved. We can use lots of different things to sedate and to anesthetize our patients. So if we know we've got a higher risk patient, or there's a patient with other kind of existing conditions, then we can tailor our plan to our particular patient. So we don't just give a one size fits all. Every single dog that gets sedated gets, you know, X, Y, and Z drugs to do that. With that in mind, we don't want to be sedating unnecessarily, especially in high risk animals. So would blood work be worth doing? So blood testing for atopic dermatitis, so for our environmental allergies, is a very reliable test. It's a good test. So yes, if we're wanting to find out exactly what your dog is allergic to in the environment, then yes, fantastic. We can absolutely rely on that blood test. There are blood tests for food allergies, in my opinion, and the evidence shows that they are not very good. Some are slightly better than others, but by and large, they are not very good. And that's where conducting a food trial, which I discussed more, again, it was either yesterday or the day before, about the kind of ins and outs of conducting a food trial for. Equally, saliva testing, hair testing of environmental or food allergies is completely useless. Don't waste your money. That's the bottom line there. With regards, is it worth blood testing? Now, it's all very well having a blood test and you come back with this beautiful panel that shows that your dog is allergic to a certain type of grass, a certain type of tree, house dust mites is probably going to be in there, maybe flea saliva. There's going to be a whole load of different things. In the vast majority of cases, you're not going to be able to eliminate those completely from the environment. And so that means that you know, how useful that is questionable. The exception here is, I mean, it's very interesting and it's great to know, and there's certainly no harm in doing it. But the exception to that is if you're then going to have a, and you have to excuse me, it's very early in the morning and the word escapes me. If we effectively immunize our patients, a hyposensitization, there we go, that's the word. That's a big word for 6:10 in the morning. We do a hyposensitization program where we effectively vaccinate our dogs. Now that can be by injection, it can be oral drops, and that's the only way we can cure a dog of their environmental allergies. About, I believe it's 70% of dogs will respond well to that with a good response. Maybe half or so will be cured of their allergies. The other 30% will still need to have all the ongoing kind of treatment managed for, you know, indefinitely. It's a longer process. It can be a little bit expensive. Obviously, that's going to vary depending on where you are in the world. But I think that's certainly something, if you're keen on doing that, if we are sure that your dog does have environmental allergies, then that could be a really valuable treatment path to curing your dog of their problem. Equally, while we're doing that, and it does take a couple of years, we need to be doing all of the other things. So all of the other things that we've spoken about: diet, supplementation, control of complications, optimization of skin quality, of coat quality, all of that kind of thing. So we need to be doing all of those things as well. So probably a long-winded answer, Teresa, but hopefully that answers your question. Richard, good to see you over here, Richard. So I've been led to believe that every few days massaging in coconut oil helps with itchy skin. It certainly makes my hands soft. Is it something that your guests would recommend? So we didn't, excuse me. So we didn't specifically speak about coconut oil, but we spoke about the importance of hydrating the skin. I've spoken about how, or at least I believe I did, how there is an inherent lack of hydration in dogs who suffer from allergic skin disease, in particularly atopic dermatitis. So hydrating the skin is absolutely important, and it's valuable. It helps provide a really good barrier. So if we think of a dog with allergic skin disease, if we think of their skin as like a brick wall, but they've had the mortar kind of chipped away, and that makes all the cells kind of leaky, which allows all of the allergens, so all of the pollens and everything else, to kind of go deeper into the skin to trigger this allergic reaction and just to make things an awful lot worse. By hydrating the skin, we basically we put that mortar back together, and we can provide a really good physical barrier, if you like, or an improved physical barrier, which can help to reduce the expression of allergic skin disease, which is fantastic. Now, there's a number of ways that we can do that. We can do that externally, and we can do that internally. So I think internally is the best way to do it, because we're actually altering the kind of the substance which is in kind of the deeper skin layers, and we're improving that, and that comes back to our omega-3 fatty acids primarily. And omega-6 fatty acids, sorry, and we can do it externally. Coconut oil, yes, it does seem to hydrate the skin. It does, kind of, Richard, like your hands, they become soft and hydrated. Yes, it can help with that. There are other products that do that, which I think are probably going to be a little bit easier to manage. They're designed specifically for skin. These are our leave-in conditioners and mousses. And I think it was Dr. Lisa who I spoke to. I think it might have been yesterday or on day 1 or 2. We spoke all about this, and also Dr. Joya, who I think we spoke to yesterday as well. We spoke more about these kind of leave-in products and that are designed specifically to hydrate the skin. So coconut oil, yes, I think it probably will help. There are other products available as well. So to a certain extent, take your pick. But I guess I like to think of using things that have been designed specifically for that purpose, that may be a little bit easier to apply, that may be a bit less, I guess, greasy and leaving marks and things like that on sofas and beds and carpets and everything else. So yeah, hopefully that answers your question there, Richard. Julia, so my border collie dog has small, very pink, flaky areas on each elbow. Recently switched to a grain-free diet, and it may be improving. I'd be interested in your thoughts. So pink, flaky areas on each elbow. So the most common way is kind of on the outside of the elbow, where we get lesions that can be kind of pink and flaky. They can also be kind of dark and crusty, and they are most likely, the most common cause of those is actually kind of an abrasion, if we think of it like a callus. So when dogs are lying down, when they get up, they push up off their elbow, and they develop this kind of callus. Now, it normally doesn't cause any problems unless it gets split. Sometimes it will get dry. We certainly sometimes see in older dogs that the area can be quite significant, and it can get a bit dry and a bit cracked, especially at certain times of year when the weather is a little bit more drying. In winters, when I find that happens, and also depending on what surface they're lying on. So it doesn't have to be like a really abrasive concrete floor. It can be a rougher carpet, and just generally how a dog moves around. Some will develop them more often than others. Generally, they, like I say, they don't bother the dog, so you're not going to find them itchy or anything like that. So that's kind of the normal cause for lesions on the elbow that are like that, which is I believe you're probably describing, Julia. Switch to a grain-free diet, and it may be improving. Now, that brings up an interesting point, and I guess it kind of goes back to what I was talking about briefly when I said what my topic of the day was, which was formulating a plan that works to cure your dog of their skin allergies, or to manage them successfully, I should say. And that is that when there is a problem, when your dog has a problem, in this case, it's allergic skin disease, they're itching, maybe they've got some lesions, whatever it happens to be, we recognize that we want to do something to help them. We want them to get better. We want them to be happy. We want them to be comfortable. We want them to be itch-free. And so we make a change. Now, in a lot of our chronic diseases, and by that I mean our long-term diseases that are with our dogs for a long period of time, they have a waxing and waning profile. So they will get a little bit worse, they'll get a little bit better, they'll get a little bit worse, and get a little bit better. When we tend to take action is when they are at their worst. And that's just our nature. I mean, with yourself, it's, you deal with a problem yourself. It's a little bit minor to start with. You go, well, I'll just wait and see how it goes before I go to the doctor, because I don't think it's anything important. It will get worse and worse and worse, and it will reach a point where you go, right, I've had enough, I'm going to go to the doctor. Now, in a lot of our conditions, skin disease, arthritis, to name but a few, they were going to get better anyway, because they were at the peak of their severity, and the natural progression of the disease is that most of them were going to improve, albeit slightly, to a greater or lesser degree. And so it's easy for us to give something and assume that because your dog improved, it was because of that thing that you gave. That's, again, only natural. It's part of our human nature to look for patterns. And, that's a natural assumption to make. This is where following the train of evidence is really important. And if there's evidence that shows that things don't make a difference, then that is far superior to our personal opinion and even our experiences, because there are various different pitfalls to avoid that we can fall into. And that's one of them. That one's called regression to the mean. The other one is the placebo effect. And the placebo effect, you'll probably be aware, is the beneficial effect that a body gets because of a belief that something is going to work. And that benefit that occurs has no relation to the actual substance that is given. So we give a sugar pill, we believe it's going to make our headache better, and our headache goes away. So the mind is a powerful thing. Now, our pets can't get the placebo effect because they don't know that we're making a change, we're giving a treatment, we've started a supplement, we've changed their diet, all with the aim of improving their itch, improving their skin condition. They don't know that, so they can't get the placebo effect. But we can get something called caregiver placebo, which is where we are so invested in our pets. We want them to get better. We want to see an improvement. And so we see an improvement even though there isn't one actually present. And that is a very powerful effect. It's something that we all suffer from. So pet parents, veterinarians as well, are just as guilty. There's been good evidence with arthritic dogs that vets were actually a little bit worse, although that wasn't statistically different, but vets were a little bit worse than pet parents with over emphasizing an improvement, even when there wasn't one to see. And that was determined by various different methods. So it's very, very interesting. But there's a whole load of different reasons why we can our mind can trick us effectively. So why is that relevant to Julia's question? Well, switch to a grain-free diet and it may be improving. So grain-free diet, it's a very popular fad at the moment. I know a lot of people will claim that grains are bad for dogs. I don't believe that at all. I think grains, especially whole grains, can provide a really good source of vitamins and minerals that are really good for life. And I think we need to be thinking about feeding nutrients, not ingredients. Grain-free, now there's been a scare with grain-free about causing heart problems in dogs. Now that's not all grain-free diets by any stretch. That's diets that are rich in peas, lentils, and sweet potato. So that's a very specific subset of diets. Not all of them were grain-free, but if diets were rich in that, then that's what seemed to be the problem. So certainly not against all grain-free diets, but I think most of the grain-free movement is marketing that has built on kind of the human fad for removing grains and demonizing grains as well. So yeah, that's kind of why I mentioned that. And so how that would impact your dog's elbows is questionable. So wouldn't like to say it's impossible, but I spoke yesterday or the day before about how grains, actually, when it comes to food allergy, grains are not the primary culprit. Wheat is number 4 on the list, quite low down, and then other grains are much lower than that, but it tends to be to an individual grain rather than to all grains. Anyway, so a lot of tangents there again, Julia, but I hope that answers your question as well. Alexandra, my dog reacts when eating oatmeal with ear infections. Does this mean I should avoid shampoos and conditioners with oatmeal? Yes, I think so, is the simple answer, Alexandra. I think even if the oatmeal substances isn't going through to through the skin and into systemically into the body, your dog's going to be grooming, going to be licking themselves. If they are allergic to oatmeal, then they're going to be exposed that way through orally, the same way as eating it. And we know that if a dog is allergic, like truly allergic to a substance, then it takes very little to trigger some dogs. So yeah, I would certainly be avoiding those oatmeal shampoos and conditioners. Now, by and large, if we're looking for excuse me, if we're looking for kind of cheap and cheerful but effective shampoo for routine use, then oatmeal shampoos and conditioners are a good option for the majority of dogs. If you actually head over to the masterclass, so I've spoken before about the masterclass, there's links in various emails. If the team will flash up the link to that masterclass now. I speak a little bit about shampoos in more detail, and I actually provide you with a downloadable guide to choosing the right shampoos with some suggestions of shampoos there. So I definitely encourage you, Alexandra, to go watch that masterclass if you haven't already, everyone else as well. And yeah, check out that section on shampoos and make sure you download that free resource as well, because yeah, even if I say so myself, it's very valuable and will give you a good idea of alternatives for you. Fantastic. So some good questions. Tara, welcome back, Tara. What do you think of using an after-bath rinse of betadine in water mixed to a strength that looks like iced tea for fungus, yeast, and bacteria? Honestly, I think there's better options. I think if you've got a dog with an existing infection, with an overgrowth of yeast or bacteria. So we're primarily thinking about our Malassezia pachydermatis, which is our yeast, and our staph species, which are our bacteria. They are normal, what we call commensal bacteria, and I'll start again, normal commensal organisms that live on the skin of healthy dogs and live on the skin of all dogs. But in allergic dogs, they can overgrow and they cause these secondary infections, which I keep coming back to as a really important consideration. If you have got a dog with an overgrowth like this, then I think we need to be using ideally where it's appropriate, a medicated shampoo. So we're thinking of either a 3% chlorhexidine shampoo or a chlorhexidine miconazole mix shampoo. I tend to opt for the former rather than the latter, although they both work well. We need to be using those appropriately, so lathering them on for 10 minutes, repeating as kind of needed 2-3 times a week. There's also kind of mousse options and things like that. Again, going back to that shampoo resource and masterclass, I discussed that there. Dr. Sharice Roth yesterday also spoke about a mix of bleach and water that we can use as a spray as being effective, which it is, but it can be very drying. So we need to be thinking of doing something else to maintain the hydration of the skin. So it's a kind of a cheap and cheerful. It's something that is available to anyone, no matter what their budget, because some of these shampoos, especially in larger dogs, can add up to, they're not horrendously expensive, but they, everything costs money, and that's not available to everybody by any stretch of the imagination, especially in the kind of current economic climate across the world. So there's that bleach and water mix, and if you're interested in that, Tyra, head back to Dr. Sharice's conversation there. Betadine and water mixed to a strength, I think that's really just going to be drying. I don't know that I would be comfortable that that's going to be enough to have enough of an effect to cure an infection that's present. I guess we also need to be thinking, and the other thing that I want to talk about is that these are normal commensal organisms. So these are organisms that normally live on the skin. So you're not going to eliminate all of the bugs on the skin of a dog for any length of time. They are going to recur, they're going to regrow, they're going to reestablish themselves, and actually having a healthy skin population is important for skin health. So we've spoken previously about the importance of the gut flora, the normal resident gut bacteria, and I believe that the normal resident skin microbe population is equally important. Again, we don't know a whole load about it. There's not been a whole load of research into that. What the ideal population is, how can we optimize it with certainty, but we don't want to be just killing all of the bugs all of the time. In a well-controlled dog with allergies, there's going to be bacteria there, there's going to be fungus there, and I think if we're using that betadine mix, we're only going to be drying the skin and causing more problems. And equally, if we're using the medicated shampoos, then I think we could be using better maintenance shampoos that have been proven, a little bit like with Richard's question at the beginning, to maintain hydration, to prevent inflammation, or just to control a little bit of low level inflammation, and that kind of thing. So Tyra, hopefully that answers your question about that. I think there are better alternatives, is the bottom line. Robertina, how can we approach a malassezia infection that goes away with medicated shampoo for a while and then comes back and doesn't respond anymore to the treatment? It is secondary to a mite allergy. So the reason that these, and this is a great question, Robertina, and kind of ties into previous ones as well. If we so a dog's currently receiving desensitization shots, but we cannot see too much of an improvement. So yeah, great questions. So that does take time. Desensitization, it can take several years to work, or a couple of years to work. Being realistic about that, and we need to be doing all of the other things effectively while those are kicking in to help control the disease, to help keep our dogs comfortable. So absolutely. So we get this overgrowth of malassezia in your dog's case, or bacteria, because of those inherent defects within the skin that are allowing these populations to proliferate. So we need to be doing all of the other things that we're speaking about, focusing on all of the other different treatment modalities for our allergic dogs. We need to be analyzing our plan and thinking what we are doing currently, and how we can maybe improve those things. Maybe that's frequency of shampooing, just for argument's sake, or what we're not doing and we can consider adding in. So that might be an omega essential fatty acid supplementation. So yeah, evaluating the whole treatment plan and thinking what can be improved. Equally, when we've got skin infections, and I've spoken about how it's far preferable to use topical treatment if at all possible. But in some dogs, we do need to use oral medication because the infection is so extensive, it's so deep, the dog won't let us shampoo them appropriately for long enough, for well enough in particular areas. It's difficult to wash them at all. There's various different reasons why topical treatments don't work fully. We need to be thinking about oral medication, so that can be antibiotics, it can be antifungal agents, to help make sure that we completely eliminate that infection, that infected state. It's also important that we treat for long enough, and this goes with our topical treatments as well. It's not just a one and done. It takes, for a bacterial and fungal infection, it takes a minimum of 3 weeks to make sure that we have hit that infection on the head. In some cases, it will take much longer than that. So it's important that we don't stop treatment too early, because that can result in a recurrence and a flare up, and basically we end up back at square one. So a few thoughts there with you, and a few strategies that you can use, and consulting with your vet about those desensitization shots, depending on how kind of far through the process you are, and unfortunately they don't work for every single dog, but hopefully Robertina, your dog will be one that it does have a great effect eventually, but it is a process to go through. Pam, my fur baby is experiencing allergies. Suggestions, please. So where to start, Pam? So really that's what this allergy summit is all about. It's analyzing all of the different ways that we can go about treating our allergies. We can we can tackle it from so many different aspects, and there's, depending on the presentation of a dog, depending on how their allergies are manifesting, depending on what they're allergic to, depending on the history of their skin disease, depending on an examination of them and the results of different tests to confirm that actually it is an allergic disease. Really depends on what the most appropriate treatment is. So I definitely just encourage you to go back and go through the talks that have been given. If you've missed out on any of them, then there's the premium passes and all that kind of good stuff that you can have access to all of those talks for forever. You can get those. There's links in your emails. You can go to ourpetshealth.com/allergy summit. And you can get access to those, and really working through that system, working through that process, and your dog will get relief from their allergies. But that's the whole purpose of the summit. So it's difficult, Pam, for me to summarize 20 odd hours of talk, and not including the Q&As and all that kind of thing in one answer, I'm afraid. But yeah, there's lots that can be done. So if your dog does have allergies, there is definitely light at the end of the tunnel. It's a little bit of a process, and there's quite a lot involved. For those dogs that are suddenly, that are really suffering at the moment, going back to my belief that we need to be focusing on quality of life, we need to be thinking about getting them as itch-free as possible, as quickly as possible, so that we can settle that inflammation, we can reset that skin, we can reclaim their quality of life, and then that will allow all of our long-term management aspects to kick in a little bit better. That's what I believe we should be focusing on in the very early stages of the disease. But I actually have a guide that is available if you kind of purchase that premium pass, but also you can go to ourpetshealth.com/allergy first aid. So that's ourpetshealth.com/allergy first aid, where you can find that guide that focuses specifically on the steps that you need to take to just really settle your dog's itch, to make them as comfortable as possible, and then to focus on that long-term management. So I definitely encourage you to check out that guide, ourpetshealth.com/allergy first aid. Great. So hopefully that helps, Pam, and I'm sure you're going to find some great information that will be highly relevant to your dog. Ambassador Dog Tiffany, love the name. How long does it take to see a change in better or worse reaction when changing a diet from whole grain to grain free? So I've spoken a little bit about grain free diets already, about how appropriate they are or otherwise, about how our food allergies are primarily to our protein component, not the grain component. But that's not to say that dogs that don't have a food allergy and have environmental allergies don't benefit from evaluation and potential change of their diet. They absolutely do. We've spoken before about how diet plays a huge role in gut health and in immune modulation, and in provision of different essential nutrients and vitamins that are hugely beneficial to controlling inflammation, improving skin quality. It can take a time, Tiffany. It can take, I would tend to say, 6 weeks or so. We might see a little improvement before then, but really it's going to be taking 6 weeks to see some change. It can take up to 12 weeks before we see any change. And the reason for this is that it takes time for the changes in the diet to start affecting the dog's body, areas that are far away from the gut. So the gut effects might be a little bit faster, but when we're thinking about incorporating these nutrients, these essential fatty acids into the skin cells, the older skin cells, kind of going through their natural life cycle and falling off, that takes time. And so we can be looking at up to 12 weeks. And some dogs it may even be longer, but really we should be seeing an improvement in that. And that goes back to what I'm saying. And I'll often hear people say, well, we made this change and the next day, and that could be with us, I'm not talking just about diet, but with supplements and things. I made this change and the next day or a week later, things are really a huge amount better. When in actual fact, really biologically, it's pretty much impossible for a change to have been seen in that length of time. Again, there's going to be exceptions to the rule, but it goes back to how we can kind of trick ourselves, because we really want to see an improvement. We're really emotionally invested, we're financially invested. It's not just pet parents, it's vets as well. So we really need to be mindful about the time it takes. So it's a really good question. We need to be mindful about the time it realistically takes to see an improvement, and not mistake an improvement that may be present as being caused by that change, or mistakenly see an improvement when one isn't actually present. And that's for grain-free diets and any particular diet and supplements as well, and any treatment change. So these are fantastic questions, everyone. So thanks for joining me and getting them all in. I have a 2-year-old Great Dane. He has anal gland issues. It's bleeding all the time due to environmental allergies. He's on Apoquel, but I heard it can cause cancer with long-term use. Thinking about starting using cannabis. Do you think it would help? So I could have touched on the Apoquel and the cancer risk, or the cancer kind of scaremongering for kind of earlier in the session. I guess with that in mind, I mean, something that need to address as well with that. I saw a lot of feedback from the first day about how the information that given was ridiculous, how it was false, spreading false information. And I'd just like to say that is a ridiculous sentiment. I was speaking to guests who are they're dedicated dermatologists. They have dedicated their life to treating nothing but skin disease in dogs. They have gone through training of at least 8 years of dedicated training, including at least 3 years of dedicated training in nothing but skin disease of dogs. So to say that they don't know what they're talking about and spreading false information is just patently untrue. There were claims of there was the usual claims of just drugs of vets being interested in just making money and not interested in the health of dogs. Yeah, I'll leave that there. If you think that, then well, clearly I'm not the person for you either, because I'm a vet and I use these drugs. I use them appropriately. I use them targetedly, but I believe that they have a good role to play. So I'll leave that there. But that also then goes back to the talk with Dr. Charisse about veterinary mental health. So yeah, I mean, I guess I don't really need to say much more than that. And I'm sure if you're joining me on this stream now, that you don't kind of buy into that. So yeah, I think we need to be careful about a lot of the claims that we hear on different forums as well. They're often, well, not often, but they can be misleading and not really reflect the truth. So but earlier in the stream, I spoke a little bit more about that cancer risk with Apoquel. Start thinking about starting using cannabis. Do you think it would help? So yes, if you've not checked out that panel discussion from day 3 yet on cannabis and CBD, it wasn't a discussion with just one cannabis expert. There were 3 cannabis experts. One of them, Dr. Amazonas, is an author of the only veterinary textbook on the use of cannabis and CBD and that whole range of drugs in pets. So all 3 are incredibly knowledgeable. It was a fascinating and fantastic conversation to have. Yes, I think it can potentially benefit. Now, I do not have personal experience with the use of cannabis or CBD, because where I am in the world, it is not available, unfortunately. Now, that is something that I hope will change in the future, hopefully the not too distant future. But I think the evidence around the use of cannabis and CBD is growing. It is encouraging. Is it the be all and end all that some people make out? I'm not sure that it is. And I think we don't want to be, just like we don't want to be relying on any single form of treatment when there are multiple different options available to manage a dog with a condition. Diet, supplementation, grooming, all that kind of thing. We don't want to be relying on one mode and one mode alone, but it could potentially work. I guess one thing I would want to be sure of, though, as well, Christine, with your dog, is that it is truly allergies. We can get problems around the back end with other autoimmune conditions, so the body's immune system attacking itself, and that can cause fistulas, which are like these deep tracks around the back end. It's more common in German Shepherds, but bigger breed dogs can get that. We can also get cancers of the anal gland, anal sac. As a 2-year-old Great Dane, that's probably much less likely. But yeah, there's definitely other things that we need to consider when it comes to diagnosis. So there may be that there's some other tests that are worthwhile running, and maybe your vet's already discussed those with you. So hopefully that talks that answers your question, Christine, and hopefully you can get some relief for your dog, because it sounds a particularly uncomfortable, impactful condition for your dog. So hopefully you can find some relief very soon. Fantastic. So if there's any more questions, keep them coming. I can just see a comment from Ambassador Dog Tiffany, so I'll just read that out. Is Ella Kogel's puppy that is a real ambassador dog that goes to Fort Lauderdale Airport, soothing passengers before flights. She also goes to the University of Miami to relax students before exams. Fantastic. I love that. It's amazing the power that pets can have in our lives, and how they can positively impact not just those of us who are fortunate enough to kind of call them our family and to have them in our lives and in our homes, but also other dogs. I had a dog in the clinic a couple of days ago, on a Tuesday today, I lose track of time, who is a therapy dog who goes into schools and has children read to her, and it just brings the children out of themselves. They love it. They don't care what the owner thinks of the book, but they say to her that, oh, you know, your dog really really loved that story. And yeah, dogs can bring such such joy into our lives, and such a benefit in a huge number of different ways. So Ambassador Dog Tiffany, thanks for that little background. That's lovely, lovely to hear. So I think that's looks like that's all the questions. If you've got any more questions, if you just get them in quickly, this is the last live Q&A from me. If there are other ones, I will try and pop back into kind of the YouTube comments section or the Facebook comments section and answer them for you. I guess there's a few kind of things to just wrap up. It's been absolutely fantastic to see you all on the summit. I hope you've all had a huge amount of benefit. You've gained a lot of information and a lot of different aspects that maybe you hadn't considered, or maybe you dismissed. Going back to my earlier comments, I think we really need to focus on providing relief for these guys. We can dive into more, into more detail on this, and how we can produce a plan that actually works. And also I discussed some of the pitfalls that are holding you back from coming up with a plan that works over in that masterclass. So that is, and yeah, sorry team in the background, I'm going to be talking about lots of links. So you can find me at ourpetshealth.com, but the masterclass link you'll find in the emails. You'll find at petsummits.com/allergy/masterclass. I think I've read that out enough to remember that. Definitely encourage you to do that. I'd love if you'd like to work with me more with coming up with a plan to fix your dog's allergies, to reclaim their quality of life, to settle their skin for the long term, then also head to that masterclass as well. I'm going to discuss more ways that you can work with me specifically in a very small group to target specific treatment for your dog, to come up with a plan that works. Because after all, if we are just coming to summits like this and we're getting all this information but we're not taking action, then that's all very well, but it's nothing but entertainment. And I'd encourage you to take action, even if that's just changing one thing in your dog's management plan. If we don't take action, then we can't hope to make a difference. But if we're going to have a true benefit, we need to come up with a truly customized, targeted plan that focuses on every different aspect of your dog's condition, right the way from making sure that we've got accurate diagnosis through to making sure that we are using every single treatment modality at our disposal. And also focusing on whole body health so that we can keep our dogs as happy and healthy for the long term, for as long as possible. So definitely check out that masterclass, petsummits.com/allergy/masterclass. Where you can find me at ourpetshealth.com. That's kind of my online home, and there'll be links to kind of all of the other different places, depending on where you are on social. I guess my big home on other platforms is YouTube, so you can get me on youtube.com/ourpetshealth. Or search for Our Pets Health on YouTube, and you'll find me there. I've got 4 videos. My 4 most recent videos are all about allergic skin disease, so you can check those out. I also have a podcast, so for those of you who are podcast listeners who like to listen to something on the commute into work, you can find me on the Call the Vet show with Dr. Alex Avery. If you search for the Call the Vet show on your podcasting app, or you can find it at callthevet.org, and that will take you to the section on my website which has got all of the previous podcast episodes. Again, my last 3 or 4 podcast episodes are all about allergies. The ones before that are about some of the summer dangers and the danger of overheating and heat stroke in our dogs, something really important at this time of the year. I know the UK, I've just been for a visit back to the UK, and it is hot, but wherever you are in the Northern Hemisphere. Summer's here, and it's important that you know about that. So you can find me at callthevet.org, or the Call the Vet Show on my podcast. Socials, Instagram is probably where I'm most active, although, I'm a vet in general practice. I work a full-time job in the clinic. I try and do all this other online stuff as well. So I certainly, if you've got a question, if you DM me, then that's the best way to get hold of me. But yeah, find me on social media. Instagram is probably the best one. Our Pets Health is my handle there. So it's been an absolute pleasure hanging out with you. I also want to thank the team at Pet Summit, so kind of the people behind the scenes, Gindy and co, who have been, and Isaac, who has been integral with helping me put this all together. Also love to just a huge thanks to all of my amazing guests who gave up their time freely to share their expertise, to dive deep into the conversations that really matter in dogs with allergic disease. Without them, we couldn't have had a summit. We couldn't have had a summit at all, but the quality of information was just astounding. So a huge thanks to all of my guests, who it was a real pleasure for me personally to chat with and connect with, and I'm sure you'll agree they were just amazing. So a big thanks to everyone, and finally a big thanks to you for getting stuck in, for asking all of these fantastic questions, yeah, just really looking to do the best for your dog as well. I think there might be one more question. Gindy's just flashed up. So yeah, perfect. Dr. Zoolittle, would you say that allergies play a role in significantly reducing dog longevity? Interesting question. I think if we manage them really well, then no. I think a dog with allergies who is controlled, who's treated, who's managed appropriately, who we can get a handle on, then no. I think for those dogs that aren't treated optimally, their lives can become so miserable that they are euthanized prematurely on welfare grounds, that their quality of life struggles, and owners just go, enough's enough. We've tried certain things. A lot of the time I find that what people look for is a kind of a one size fits all single treatment option that works. And unfortunately, allergies, that's not the case. Even if we are just relying on pharmaceuticals, we will get flare-ups, we will get secondary infections. In the majority of cases, we will not be optimally treating. And there is the potential for premature euthanasia. Does it equally, I guess, if we are relying on steroids, I've certainly seen that with really high doses of steroids. And this is going back, before we had these other options, which I've kind of touched on already. Before I had these other options, we did used to need a lot of steroids for a lot of dogs. I'm thinking particularly West Highland White Terriers, who have horrendous genetics that predisposes them to horrendous allergic skin disease. We were potentially dealing with side effects that affected their longevity. But the alternative to that was compromising their quality of life. And I think quality of life is key, as I've said before. So yeah, that's my take on that. I don't have any stats to back that up, or any evidence behind that, but that's my kind of personal feeling. Fantastic. So yeah, thanks everybody for joining me. It's been an absolute pleasure. Thank you for taking action. Make sure you check me out wherever you are. There's that masterclass, there's that guide that I've produced as well. Again, that's ourpetshealth.com/allergy first aid. I'd love for you to check that out. It's it took a long time to put together, and it's got a really huge amount of information and actionable information. And all that's left for me to say is I hope you have a fantastic rest of your day, rest of your week. I wish your dogs the best health possible, an itch-free, allergy-free life. And yeah, I look forward to connecting at some point in the future. So with that in mind, everybody, take care. It's been fantastic spending some time with you over the last few days. And I hope to talk to you or speak to you or see you soon, wherever that may be. Take care, everyone. Goodbye.